Good afternoon, everyone, and welcome to today's update on New Brunswick's Return to School plan. Bonjour tout le monde et bienvenue à cette mise.
Hello, and welcome to today's update on Back to School in New Brunswick. Our speakers today are the Chief Medical Officer, Dr. Russell, and Deputy Ministers George Daly and Marcel Lavoie.
Today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and Deputy Ministers of Education and Early Childhood Development, Marcel Lavoie and George Daly. Dr. Russell?
Thank you, Danielle. Merci.
Thank you.
Good afternoon, everyone. Bon après-midi à toutes et à tous. When the first cases of COVID-19 were detected in New Brunswick 5 months ago, our first task was to slow the spread of the outbreak and limit its impact on our healthcare system. We have done that very effectively, thanks to the vigilance and discipline shown by New Brunswickers and, of course, all of the hardworking people in public health and our partners. Lorsque les premiers cas de COVID-19 ont été
When the first cases of COVID-19 were detected in New Brunswick 5 months ago, our first task was to slow the spread of the outbreak and limit its impact on our healthcare system. We have done that, and very effectively, thanks to the vigilance and discipline shown by New Brunswickers, as well as with the hard work of our public health workers and partners.
We work hard to slow the spread of this disease, but our more important task at this stage of the pandemic is to learn to live with COVID-19 and reduce its negative impact on our society. The reopening of our public schools, which have been closed since this emergency began in March, will be a test of our ability to live with the virus. And I believe that New Brunswick is ready to meet this challenge, but it will require ongoing collaboration among schools, educators, support staff, parents, and students for us to succeed. And I understand that, again, many people have many concerns about what's going to be happening in the fall in our schools, and this is normal. It's very normal. Je sais qu'il y a beaucoup de gens.
I know that people are very concerned about schools and going back to school in September, and that's normal. Like with the start of the pandemic, there were concerns with healthcare workers, etc. So the plans and the work that we're doing in order to have safety plans and to reduce risks is our main task.
And the anxiety and the worries and concerns of all the people who are going to be participating in the opening of schools, et cetera. But the work and planning that's going in right now is really a collaborative effort. We did the same thing when it came to healthcare workers at the beginning of the pandemic and other sectors along the way. So at each stage of the pandemic and each sector of the business community and healthcare workers, et cetera, we've had a collaborative approach with respect to making sure that things can be done in the safest way possible, knowing that we're in a pandemic and we have cases in our province right now, we have cases outside of our Atlantic bubble and outside of our country. La réouverture.
Reopening schools since the start of reopening schools will challenge our ability to live with the virus. I think New Brunswick is ready to rise to the challenge. But parents, students, and schools will have to continue to collaborate in order to succeed. Many people see the resumption of school as a return to normal for New Brunswick, but it's not the case.
Will be seen by many as a sign that things are returning to normal for New Brunswick, but it is not. And we are still continuing to have discussions at the national level in fact, I'm missing one of the meetings with the Special Advisory Committee, and all of the topics revolve around school openings right now across the country. So these are discussions that are very pertinent and very relevant and very important at this time. If normal means that we can drop our guard against this virus and live as if it is no longer a threat to us, then we are still a long way from that. If you are tired of this virus, and I'm sure many of you are, remember that the virus is not tired. It is still out there and we must treat it with respect. We must go forward with caution and with vigilance, but we must go forward. Je vais juste répéter en français.
I'm just going to repeat in French what I just said. With regards to national conversations that have been taking place. These are conversations that are happening today every province is trying to figure out what to do with schools. It's a very relevant conversation to have. It's extremely important, and we will continue to have these discussions in order to assess the situation as it unfolds.
Caution and with vigilance, but we must go forward. Our children can't wait for the return of full normality to get on with their lives and their education. Nous devons aller de l'avant avec prudence et
We must go forward with caution and vigilance, but we must go forward. Our children cannot wait for the return of a full normality to get on with their lives and their education.
As we move forward in this new normal, our goal is to limit the impact of COVID-19 on our schools. We can't eliminate the impact of COVID-19. We can't erase the fact that it is going to be with us for quite some time. And I think the more we can normalize the approaches and the processes that we're going to see unfold repeatedly over the next several months, I think that's what we have to get comfortable with. C'est important qu'on peut normaliser les processus.
We have to start normalizing the protocols that we'll have to be living with in the coming months with students, with teachers, with staff, and parents. It's very important that things unfold in a way that becomes second nature to us for the population.
Remember that we can't completely eliminate the virus. What we can do is reduce the risk to the extent humanly possible and give our children the opportunity to continue their schooling with as many safeguards as we can put in place. Testing continues to be one of the several key elements in our strategy to limit the spread of COVID-19, alongside public health measures such as physical distancing and safe hygiene practices. And some people ask me, you know, how are we doing? How are things going? It looks like we're doing well. We still have cases, however. But in terms of the best case scenario, we will continue to see cases. But if those cases have already been self-isolating at the time of their diagnosis, that means there are zero or very small numbers of contacts to trace and very small numbers of people who will be in contact with COVID-19 and very small numbers of people who would be infected, and thereby a smaller number of people who that would result in complications that would need hospitalization or ICU, etc. So we have many things in place right now that we want to continue with. Qu'est-ce qu'on voit maintenant avec
What we're seeing now with cases is that throughout the summer, we identified cases that came from outside of New Brunswick, from outside of the Atlantic bubble. And this means that people that were diagnosed were people who were already self-isolating. This means that there were almost no close contacts to seek out and contact, and it means that there were fewer people that got infected.
Reviewing and updating our testing protocols to keep pace with our understanding of this disease and the circumstances facing our province. Les tests de dépistage continuent.
Regular testing will continue to be an important part of our strategy to limit the spread of COVID-19, alongside with public health measures like physical distancing and safe hygiene practices. Also, people who come from, and also isolation for people who come out of the Atlantic bubble. We are regularly reviewing and updating our testing protocols to keep pace with our understanding of this disease and the circumstances facing our province. With the reopening of public schools next month, we will offer regular testing for COVID-19 to all teachers and school staff in New Brunswick. This will be available for people who are asymptomatic or who think they might have been exposed to COVID-19, whether it happened at school or not.
Public schools next month, we will make available testing for COVID-19 to asymptomatic teachers and school staff who are concerned about potential exposure, and this will be available on a voluntary basis. We are taking this step because of what we have learned about COVID-19 and how it is spread. There's also a precedent set in other settings whereby, for instance, we were testing long-haul truckers. We were testing preoperative patients in hospitals before surgery. So there's different steps we've taken along the way to just reassure ourselves that there aren't cases that we would be missing out there. So we're being proactive, and we're taking these steps just as we have all along during the pandemic. We must all be vigilant for the symptoms of this disease and contact Telecare 811 or your primary care provider when they emerge. It's vital that everyone, teachers and students alike, stay home when they are not feeling well. Juste pour répéter ce que j'ai dit en anglais tout à l'heure, au niveau...
I just want to repeat what I said in English earlier. Throughout the pandemic, we had processes in place to have people tested. We were testing pre-op patients. We were testing people who were truckers. So these are processes that have already been put in place in other sectors, and it's something that we can do for back to school.
When you're not feeling well, staying home when you get tested, etc. I know this is going to be a hardship for many people, but again, that has to become part of the new normal, that it's expected that many people will be tested. And as I've said before, our testing so far has revealed that out of 1,000 tests, we usually only get one that comes back positive. So that means that as we go through the school year, there could be thousands of students that eventually get tested and teachers that get tested, but very few we expect to come back positive. But that means we have to become very comfortable with the idea that people are going to be tested on a regular basis. We have symptoms of coughs and cold and flu seasons coming. So this is going to be something that we want to set the expectation that this is the normal aspect of going to school, that we have to get tested when we're not feeling well and we have symptoms, and we have to stay home. But we can also know that COVID-19 can be asymptomatic. A person can contract and spread the disease without showing any symptoms. But again, if the imported cases that are coming in outside the Atlantic bubble are self-isolating, then again, that minimizes the number of close contacts that we would be expecting in terms of tracing. But we know that the contact can happen at any time and those exposures can happen at any time. And that's why we all have a role to play in being vigilant. Alors aussi, pour répéter ce que...
So I'd like to repeat what I just said in French. It has to become normal to get tested frequently. Cold and flu season is upon us. People will start coughing. So we have to get comfortable with the idea that there will be thousands of students and teachers that will get tested. It will just be normal. Yes, you'll get tested. But like I said earlier in other press briefings, for every 1,000 person that we test, 999 people are testing negative and with only one positive. So it just means we're going to test a lot of people to find cases, and that's normal. When people go for a test, we have to accept that this is a normal thing.
Voluntary asymptomatic testing for teachers and school staff, we will be better able to identify and isolate cases of COVID-19 in schools before the disease can spread widely. Our contact tracing will be the same. The process will be the same. When we find a case, we will do the contact tracing, and those people that are considered close contacts will be told to self-isolate, etc. So when you hear from public health, follow the directions, and public health will be informing schools when there is a case. So they will be informing the principal, and the principal will inform the student population, parent population, school community. Public health is finalizing the process to ensure the type of testing for teachers and staff is available in time for the return to school in September. La santé publique
Public health is finalizing the process to permit this type of testing in time for the return to school on September 8th. We also have many students coming to New Brunswick from outside the Atlantic region to attend public schools and post-secondary institutions. Testing will be part of our strategy for limiting the potential spread of the disease among this group. Students from outside the region will be required to self-isolate for 14 days upon arrival in the province and will be tested on the 10th day of their isolation period.
Students coming to New Brunswick from outside the Atlantic region to attend public school or our post-secondary institutions. Testing will be part of our strategy for limiting the potential spread of the disease among this group. Students from outside the region will be required to self-isolate for 14 days upon arrival in the province and will be tested on the 10th day of their isolation period. This protocol has proven effective in identifying COVID-19 cases among temporary foreign workers in recent months, where we have identified several cases before the workers moved into the broader community, and therefore there was no transmission. These measures will reduce the risk presented by COVID-19 to our education system. We can't eliminate the risk, but we can and will take steps to slow down the spread of this disease. This is all part of the new normal. It's what we must do to get on with our lives until a vaccine or other effective treatment becomes widely available. New Brunswickers have met this public health crisis with determination, common sense, and kindness. And if we continue to do this, we can give our children a measure of the normality that they crave in these abnormal times that is so important for their social development and for their education. We will be working hard over the coming weeks to give all our kids this chance. Ces mesures visent à réduire le risque posé par le COVID-19 pour notre...
These measures aim to reduce the risk to our education system. We cannot eliminate the risk, but we can take measures to slow the spread of this disease, and we will do it. It is so important for the social development of our children and for their education. All of this is part of our new normal. It's what we must do in order to start our life again until a vaccine or a effective treatment becomes generally accessible. New Brunswickers have confronted this crisis with determination, common sense, and kindness. If we continue to do this, we can give our children a measure of the normality that they crave in these abnormal times. We will be working hard over the coming weeks to give all of our kids this chance. Thank you very much. Thank you, Danielle. Thank you, Dr. Russell. We've been able to collaborate closely with her team in the last months, and it has allowed us to create the guides for back to school that were published last week. So I'd like to recognize the excellent work of the members of her team. Thank you very much. Thank you for being here today for this update on back to school. I am Marcel Lavoie, Deputy Minister of Education and Early Childhood Development in the Francophone sector. I would like to start this session, and after George Daly, the Deputy Minister of the English sector, will provide more information. Today, anticipating the upcoming school year, we are focusing our efforts on providing information to families who have vulnerable children. In fact, this is a source of concern for many families, and it has been for the last few weeks. With this update, we're hoping to give clarifications that will allow these families to know what to expect with regards to back to school and the school year to come, and we hope that we'll be able to reassure these parents. As mentioned by Dr. Russell, we have a lot of unanswered questions. It's probably impossible to answer all of them before school starts again, but we'd like to be able to reassure families so that parents have what they need to have a positive back to school. The most important thing that families with vulnerable children need to know is this. Regardless of the type of vulnerability of a student, the school will put in place a plan to ensure continued support throughout the school year. As it was the case in the past, parents will collaborate with school staff to develop a personalized learning plan for their child. All students from K to 12 who already have taken advantage of assistive technology will continue to have access to it. We know that the learning model selected for secondary schools, the mixed environment where students will go to school every other day, has raised questions from parents of children with special needs. We will talk about some of these issues about the mixed environments and what high schools will look like in the coming weeks. However, at this stage, it seems more important to reassure parents. High school students who have complex needs and who normally have access to various support services in school will continue to go to school every day to continue to have access to those services as long as the school environment is safe for them. It's important to note that kids from kindergarten to 8th grade will go to school physically full-time and will have access to the same support services that they had in the past. As you know, many factors need to be taken into consideration when we want to assess the vulnerability of a student. There's no universal approach that applies. In the entirety of the province, school will always be an inclusive space where students will always have the chance to learn and to grow. The department and school districts will continue to collaborate in order to support all schools so that they can offer families with vulnerable children or with immunocompromised children an education that is tailored to their needs. Students with major health problems are encouraged to consult a healthcare professional to determine if it's safe for them to go back to school. In cases where it is not advisable for a student to go to school, parents should communicate with the principal of their school starting August 31st. A plan will be developed in collaboration with the family so that they continue learning at home. It is also important to take into consideration students who have a family member who's immunocompromised. In such situations, healthcare professionals will recommend that students not go to school. For these children, a learning plan at home will also be created. These plans will vary according to the needs of each student. I'd like to repeat that all students will learn full-time throughout the school year. It also seems important to me to specify that families who choose not to send their kid to school and who is not immunocompromised, these families will have to make an exemption request to receive homeschooling. This form is available on our website. For vulnerable students, there are many factors that need to be taken into consideration. I would like to invite my colleague, George Daly, to provide you information concerning plans for these students and other information with regards to school transportation.
Thank you, Danielle, and I too want to extend my thank you to Dr. Russell and her office for the work we've had over the recent months. Putting these plans together have taken countless hours, and I know all of our staffs have developed some close friendships here over these recent months, but I think we're getting there. As we're all aware, this year certainly has had major effects on each of our own personal situations. And this is even more so for those who are in vulnerable situations, and that includes a large number or a vast amount of students. We also know that some students who may not have been considered vulnerable prior to the pandemic are now experiencing difficulties, and that is something that we will certainly take into account with our planning. Beginning August 31st, schools and district education support services teams will begin evaluating and working with parents to determine which vulnerable students may require daily school attendance or altered school attendance, which could be home learning. These decisions and the associated communications with the homes and parents should all be completed by September 4th. There are a variety of reasons that a student can be considered vulnerable, including, and not limited to, being immunocompromised, students that have significant physical or mental health challenges, and students who face difficult home or food insecurity challenges. These things will be taken into account and consideration by our teams. Again, these situations are going to be evaluated on a case-by-case basis to provide the best situation for each individual student. And all the other resources that were there previous to the COVID will continue to be there, such as our counseling programs and our food security programs. I want to reiterate, though, any student whose family has decided to not send them to school for any non-medical reasons or because of fear of the pandemic will be required to complete an annual homeschool request form that is available on the EECD website. When it comes to transportation, vulnerable students will be traveling via the bus, the same as they have in the past, following the directions that have been shared with you for other students. This will be the case unless there are medical reasons that would determine needed alterations. In that case, we will work with those families on a case-by-case basis. As a reminder, K-5 students are not required to wear a mask, and they will sit alone or with a member of a family on the bus. Students in 6 to 12 will be able to sit 2 per seat, but if that is the situation, they will be required to wear a mask. In addition, they will be required to wear the mask when they are embarking and disembarking the bus. All students will sit in the same seat every day to facilitate contact tracing if the situation should arise. Clear curtains are being installed to provide a physical barrier with the bus driver while students are getting on and off the bus. If physical distancing is not possible, the bus driver will be required to wear a mask or with a shield if the driver prefers. To reduce congestion and promote physical distancing, whenever possible, buses will be filled from back to front. This way, students will not have to pass each other while they're getting off or on the bus. Some districts have already begun rolling out their schedules, preliminary ones to families. District staff are hard at work finishing up these plans, and as soon as possible, they will continue and roll out more of those plans. Over the coming week or two, parents can expect more of this information to be sent directly to them from their district and school. As a reminder, all K-12 students will begin the school year on a staggered schedule, as is a normal practice. Schools will communicate those plans directly as they have in the past. We recognize that this has been a challenging time for families. Back to school is always stressful enough in the regular situation, let alone in the middle of a global pandemic. We want to assure you that the Department of Education and Early Childhood Development is doing everything possible to ensure this transition to school proceeds as comfortably as everyone can possibly have. Please, parents, remember that these plans and the implementations will evolve throughout the coming year. There will be adjustments, and they will be aligned as there are changes and recommendations from public health. Finally, we want to reassure parents that the entire education system is working to keep families informed as we return to school for September. School districts will be contacting families over the coming weeks through their various sources such as email and social media. Staff at the Department of Education will also continue to provide regular updates, including our next conference here next Tuesday, August 24th. Thank you, and we will now take questions from the media.
Your Deputy Minister George Daly. Okay, we'll proceed now with questions from the media. Each reporter will have one question. You can pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Chaque journaliste aura une question. Vous pouvez poser vos questions dans la langue de votre choix. Vicky Hogarth, Charlotte County TV.
Thank you. This question is for anyone. Some students have absent parents. How are you ensuring that those students have access to clean face masks, and how are you advising parents in general to launder face masks regularly?
There will be training sessions going on for students as they return. The school districts are looking at setting that up already. With regards to students who are in difficult situations at home, we have always dealt with those students on an individual basis, and the schools will reach out and see what is needed. Nothing is going to be any different in the situation. We'll make sure that those kids are looked after.
Thank you, George. Vicki, do you have a follow-up?
I do. I have a follow-up for Dr. Russell. Dr. Russell, new research is showing that testing sewage could serve as a valuable tool to track outbreaks by essentially tracking an entire community without needing to swab everyone. Is this something worth thinking about implementing in New Brunswick? And if so, could this be valuable when there's a return to school?
I have heard about that type of research, and I haven't been involved in any direct conversations recently, but I do know that discussions took place around that particular type of testing. As of right now, our plan for the back-to-school public health approach is what we've outlined so far around the plan that education has that was worked on with public health. So that's what we're sticking to at this point in time, but if there's something new or different that pops up and changes, we will keep you informed.
Thank you.
Thank you, Dr. Russell. Thank you, Vicki. Tim Rozelle, Global News, your first question, please.
Hi, good afternoon. Perhaps this one could be addressed by either Dr. Russell or Mr. Daly. just regarding vulnerable students, I know the information that was given was, saying that families are going to work with schools and staff to determine which students may or may not be able to attend every day or may have sort of different schedules than others. Could you further define vulnerable students? Like, are we talking, perhaps students with autism spectrum disorder or things like that? What would that definition, that broad definition, be?
Thanks, Tim. It would be pretty all-encompassing to students who had a high level of special needs. We had indicated earlier to you students who certainly, with relation to the pandemic, students who have compromised situations, food security issues and things of that nature. But we have a large group of students who would have been considered vulnerable previously, and they would have had plans already in place. So the intention would be for those plans to stay put, and services and things to stay as they were previous to the pandemic. I would say in the vast majority of these cases, this will ensure that the students are in school more often and probably on a regular daily attendance. However, some of the individual plans for students also indicate that they are not personally able to sustain a full day at school, so they have altered schedules and things of that nature. So I'm not sure if that gets exactly at your question, but if you wish to refer to our large document, Tim, that's on the ECD website, there is a full section there on vulnerable students, and there is more definitions to go in there. And I would encourage others to have a look at it. I know parents had the 14-page document sent out, but we have another very detailed document that's 60-plus pages that's available on the site as well.
Daly. Tim, do you have a follow-up?
Yeah, just somewhat related to my last question, but how much of the early part of the school year, the first few days perhaps, will be devoted to, trying to educate students on the things that they are able to do right now and the things that maybe they can't do right now that they would have been able to do in a non-pandemic environment?
Tim, in that large document, a section of it contains our operational plans guideline that all school principals are going to be putting in place. So we had province-wide meetings here for 3 days with Marcel and I and every principal to go through those documents and the needs of the schools. So the principals will be preparing them, they will be sharing them with the homes. In essence, the first week is going to be a staggered entry for all students, and it's exactly for that purpose. Smaller groups of students coming in, getting them accustomed to what is the actual building going to look like, what are the routines going to be. Really the classrooms are going to be very similar, K to 8, to what they were previous to the pandemic, and we actually will probably have some better situations because of the lower staff ratios. We know the transition times, though, are going to be different. We know noon time, things of that nature. When students are outside, there will be controls and restrictions put in place there beyond the regular situation. So that's all going to happen in those first couple of weeks, and that will be communicated to parents what that looks like. Marcel's going to add to that as well.
I think it's important to highlight that in the next weeks, we will experience a transition. Classes will open progressively, and this will allow teachers and school staff and strategic teams to support families and establish plans that will be targeted and that will be developed to support children's well-being. In many cases, students will go to school every day. This is the case for K to 8. And in high school, some students will be attending every day. It's a matter of health. And you can find a document on the department website. It was developed for schools and school districts. It's similar to the one that was provided for parents. It provides a ton of information There's an entire section devoted to vulnerable students in that document, and you can find more information on what defines vulnerable for students and what support processes are in place to establish plans for these students to make sure that they can go back to school safely or that they can stay home and have an education plan and support at home.
I just have a follow-up comment for Vicky Hogarth's question about the testing for COVID in sewage systems. That could never really replace testing, doing swabbing for individuals, because that's the only way to diagnose a case and decide who needs to be isolated and do proper contact tracing. So whatever types of things would happen with testing for sewage, it could never really replace the individual testing and contact tracing and isolation that needs to be done to contain COVID-19 outbreaks.
Thank you, everyone. Thank you, Tim. Mia Urquhart, CBC, your first question, please.
Thank you. The Back to School plan doesn't have specific directives about special needs students. How will they be accommodated in your Back to School plan, and when do you expect to tell parents about those details?
Actually, that does fall under the whole category here today of vulnerable students. Students who have personal plans, there's a process that's been in place for probably a decade or longer, maybe my entire career, where teams will be in contact with parents when they go back on the 31st. So at the early part of the year before school actually starts, teams will be reaching out, they will connect with parents, they work through those plans. There's documents that parents sign off on that they are in agreement with the plans. So that is pretty well standard operating procedure, and really that process should not change. I think the anxiety level this year around the virus has made people more concerned that, you know, were there going to be changes to that? Was there going to be some other type of reaction to that? But that process, it serves us well. It's well dated, and we will continue with that. So parents will know before the students return. The plans will be in place.
George. Mia, do you have a follow-up?
I do. The president of the union that represents EAs is hoping more people will be hired to help with what is expected to be new challenges for them and their students. So will there be more EAs in schools?
We have not increased the number of EA allotments for this current year. We actually have better teacher-student ratios in the classroom, so the K-8, so we know that students are going to be able to have more time directly with the teachers, so that in hopes will lessen some of the load on the EAs. Students who previously had one-to-one EA situations assigned, those will be maintained. So at this point, we believe that the supply or the allotment of EAs will be able to match the service that we had provided previously.
Thank you, George. Marcel?
I have a similar answer for the French sector. There has not been any additional EAs. With the conditions for back to school and the entire school year, we already have smaller class sizes in elementary schools, so we think we'll be able to meet the needs. In regards to high school, considering the clientele being cut in half, we'll only have half the population in class every day. The ratios will also be shared, and so we do not plan to hire more EAs.
Thank you, Mia. Adam Pert, Hearings, Telegraph Journal, your first question, please.
Thank you. I wanted to ask you announced there that school teachers can get COVID-19 tests without symptoms. I just wanted to elaborate on how that process works. And whether if students were considered in that, or if they are part of this in terms of getting tested.
Hi, Adam. So as of right now, it's teachers, EAs, support staff, et cetera, for the school system. And it doesn't include students at this moment in time. I think, again, as I mentioned, throughout the pandemic, we've looked at different sectors and different populations to do sentinel testing, et cetera. So our testing strategy has always had that built into it with respect to testing asymptomatic people. And I think that there's many different benefits to doing that. And in this setting, again, I think where the schools actually employ something like 15,000 teachers, there's quite a large population. We do want to be able to, again, have that surveillance piece built in there for right now. And certainly the students who have one symptom will be continued to be tested. We're going into flu season. We have coughs and colds, et cetera, that we see. And we do want people to feel very comfortable getting tested. So again, that was just part of the strategy we worked out with education as we were moving through our testing strategy. And it seemed to fit, and it was quite timely.
Thank you, Dr. Russell. Adam, do you have a follow-up?
Yes, Lisa, I think this is for everyone here today. I wanted to ask about the general elections impact on the back-to-school plan. Is there an impact at all, and what can and can't you do with the province in election mode, and can you be as agile as if there was a full government in place?
Well, I have to tell you, I'm really missing being back teaching political science right now to be able to miss out an election and have all that fun with my kids. But from the department level, there really is no difference for us. Certainly, it has an effect on the elected officials and the relationships that they can have with the department. However, it's my and Marcel's role to make the departments functional and operationalized, and we're going to continue to do that. It's not going to have any effect on any of our plans. We realize the election is going to go forward. We're going to keep doing the business that we do, and we're going to make sure that we've got the schools ready and the kids and everyone back safe and sound as we can when the school starts.
Thank you, George. Thank you, Adam. Sophie Deshôtels, Radio-Canada.
Sophie Deshôtels, Radio-Canada. My question is for Dr. Russell. About testing, do we know if teachers and personnel will have access to swabbing testing, but also to saliva-based testing, since we know that these tests are hard to go through? If I understand your question, you're asking about testing for school staff, teachers, and their family members? Is that your question? Yes. At this time, testing is only for teachers and school staff, but thank you for the question. Sophie, is there a follow-up question? Yes. So for these tests that will be done on teachers and staff, are we looking at non-swab tests, for example, saliva tests? So you're asking about family of staff members. The families will be tested only if they have one symptom. It's the same process as for students and the general public. As soon as you have one symptom, you call 811.
Question, please.
Thank you. This question is for Dr. Russell. Are students with asthma among those considered vulnerable to COVID-19? And if so, what do you suggest they do?
I think for today's purpose, the education component for the vulnerable populations, I didn't think included those kind of special needs. So George is saying, no, that didn't include that population.
I think with any particular condition, there's different grades or different levels to it. So what we recommend is anyone who has medical conditions to consult a medical professional to get advice as to whether they should be back in the system, and then based off that advice to initiate conversations with the school principal and see if there needs to be a plan in place.
I think it's important to reiterate that there isn't a single clear definition for a vulnerable child. If you have any doubt, we encourage you to seek advice from a healthcare professional. It's the only way to ensure that kids can go back to school safely.
What specific plans have you and districts come up with to deal with the traffic jams and potential safety hazards in front of schools now that more parents will be driving their kids to school?
Well, fortunately, I haven't been out doing the 292 plans that are going to need to happen to monitor that, but it is one of the things we've talked about with the principals. It is part of consideration for them in around their operational planning. Some schools it is not going to be problematic. Some others are looking at whether they're going to need assistance there, monitoring traffic, whether they would need to find a secondary drop-off, perhaps half a block down the street. Some schools are entertaining that possibility. So it's really going to be on a school-by-school basis. We are looking, and schools are looking at staggered schedules, which when I'm suggesting staggered in this case, it could be a 10 or 15-minute different start for some classes, which would give windows where parents could drop off, not an absolute requirement that they drop off at those times, because we know parents are going to have to match their work schedules as well, and we're making sure that supervision is aligned to match that. However, if parents could drop off within particular windows, that may facilitate the traffic in particular areas. So I've got a lot of confidence our principals are going to figure that out. It could be a challenge for the first couple of days till we get used to it, but our province has lived through a pandemic here so far, and together we've made it through. So I think a little bit of patience and some planning, and we can make it through traffic concerns.
Thank you, George. Thank you, Alexander. John Chillibeck, Daily Gleaner, your first question, please.
Hi there. It's a question for Dr. Jennifer Russell. Dr. Russell, today the public health issued an advisory about a Salmonella outbreak, and I noticed that when you looked at the cases, they were June, July, and the first case was about 64 days ago, and the most recently diagnosed case was 24 days ago. So I was just wondering why there's a lag in declaring a public outbreak there. And second question, the Public Health Agency of Canada had issued an advisory about onions from the States spreading salmonella across Canada, more than 300 cases. So I was wondering if this one was possibly linked to that one. Could you explain a bit further? Thanks.
So these types of outbreaks happen from time to time. They're not rare, and so when they happen, the process for figuring out how they're linked, if they're linked, involves some genetic testing of the actual salmonella to see if the strains match. So then you can see if every single person who was infected, if it came from a similar source. And so in these cases, by the time all that testing was done, I mean, we could say, oh, this person had salmonella, this person had salmonella, this person had salmonella. But to be able to declare an outbreak, the genetics of these cases had to be matched, and that's done through the NML, the National Microbiology Lab from Health Canada out in Winnipeg. So that does take some time, and yes, I did see the Public Health Agency of Canada notices about the onions. In this particular case, based on the typing, the testing, the genetics of the strains that we're looking at, they have been traced back to poultry and or eggs. So that's that's how the process unfolded, and that's where we are right now. So we're sharing that information right now. And the most important part of our messaging today about the Salmonella outbreak is that we really want people to be very, very careful in terms of their food handling procedures. We have information on our website about how to handle this type of food very safely. We know in the summer months, perhaps people are leaving things out on the counter longer than they normally would, et cetera, and the temperatures have been quite warm. So that could have contributed to some of these outbreaks and infections. So again, for the message for today is yes, there's a Salmonella outbreak. It has been traced back to poultry and eggs, and we want people to be very vigilant about how they handle their poultry and eggs in terms of safe food handling, and there is information on our website around that. Thank you for the question, John.
Dr. Russell? John, do you have a follow-up?
Yeah. It is difficult to hear, so forgive me if you've already answered this bit, but I just wanted to clarify. So when it comes to the onion outbreak that affected people across Canada, did anyone in New Brunswick actually test positive for that Salmonella strain, or did that not come up here at all?
All the data that I have on that, John, is around the types that were, the strains and genetic types that were sent to NML for all those positive cases here in New Brunswick. My understanding is there haven't been any linked to the onions, and so all the ones in New Brunswick are linked to egg or poultry.
Thanks.
Thank you, Doctor. Thank you, John. Simon Delorque, l'Acadie Nouvelle.
Acadie Nouvelle. I have a question regarding mental health. Some parents are concerned about the mental well-being of their kids after isolation and anxiety related to isolation. So the question is for Mr. Lavoie. We know it's difficult to access psychological treatment in schools. Have you planned additional resources? Do you have a plan for this? Thank you for your question. Like you, I read the report that was published today regarding the survey that was done among parents and said that parents are concerned about this. I would say that I'm also concerned about it. The experience that students went through in the last 6 months is important, and we know that it has consequences, negative consequences on youth's mental health. It's very concerning. So we are working closely with the Department of Health as well as Social Development and Public Safety. And so we are sharing integrated service delivery plans, and we've been working on improving services in this area throughout the summer. We are hoping to improve services and access to services and to make sure that we can respond to needs in a timely fashion. Another thing that I would like to talk about is in high school, students will be home every other day. And so we had a conversation this morning with all of the districts to discuss the challenges that could arise when students are left home alone. The risks are increased now. And therefore, it will be important for us to have teachers who take care of this issue, who pay attention to it when they connect with students, so that they can be on the lookout for students who might be going through difficulties, and that way they can make sure to offer services in a timely fashion. I have a question for Dr. Russell. In regards to the election. Have recommendations been made to the political parties with how to run their campaigns? Is there a document that was delivered to the parties? I'll answer the question regarding directives. For elections NB, the director took the advice that we gave to all businesses in New Brunswick. There's a form that you can fill to develop an operational plan. Every business in New Brunswick has done this. So they sent us their plan, just like every business has done. These are called operational plans. And when we read their plan, we made recommendations. So that's the communication we had with Elections NB. Does that answer your question? Yes, thank you, Dr. Russell, and thank you, Mr. Lavoie. Radio-Canada. The question is for Dr. Russell. I'd like to come back to this question of Salmonella in New Brunswick. Do you have any additional information? Do we know where this outbreak came from? We're continuing to do research. People have suffered from it in the north and in the east. It's difficult at this time, but we are trying to get to the bottom of it and to find the exact source. Currently, we know that it's poultry and eggs that are the most concerning, and they are what triggered the announcement today. We want to tell the public to be very careful about how they handle poultry and eggs. There's information available on our website in order to teach people how to handle these products safely. We also know that it was very warm this summer, and maybe some bacteria developed faster under the same circumstances as they would at any other season. So on our website, you can find more information on how to handle these products safely. So we're talking about a fairly recent outbreak between July 16th and 17th. Are there other cases that were noticed elsewhere in the province, maybe earlier? So the cases that were identified were between June 16th to July 27th, and there are several other cases that are being investigated now, but I don't have any further details about them. And it's still about poultry and eggs, yes.
Merci. That concludes today's update. Thank you.